Good afternoon, everyone. My name is Bernard Rubenstein. I am with Franchise Benefit Solutions. I've been your rep for a couple of years now, and we're going to follow the agenda a little bit here today. We did have a renewal that's effective August 1st. Let you know that we have moved the renewal to September 1st. So what we're going to discuss today will be your power of choice, your choices, how it works, eligibility and enrollment. We'll review the benefits. Like I said, the effective date was September 1st, and it will be all the way through August 1st will be next year's renewal. Now, the renewal that we're going to discuss here is mainly going to be the healthcare, the other benefits, dental, vision, etc. All those benefits will remain the same, as well as the rates for the at least through 2024. And then we'll discuss how to enroll or make changes. So you have the power of choice. Joint Chiropractic offers a benefits package, enabling you to design your own plan. You choose the benefits that fit your own needs and your budget. Joint Chiropractic has set up a contribution level. The rest is up to you. You decide what you can afford and what you want to spend. Through payroll deduction, which means it's pre-tax, choose from 3 health plans: dental, vision, telemedicine, supplemental health plan, voluntary life, accident, critical illness, hospital indemnity, and short-term disability. The contributions you make toward your employee benefit plan are deducted on a pre-tax basis. This automatically reduces the net cost of the benefits to you by lowering your taxes and increasing your spendable income. So basically what it means is your payroll deduction is deducted pre-tax, so it's before any of the taxes are taken out. So the taxes then are based on your income after your payroll deduction. So who can enroll? Any employee that works at least 30 hours a week, legal spouse or registered domestic partner, and children under the age of 26. When can you enroll? You can enroll within 60 days of your date of hire during annual and open enrollment, which is now, and within 31 days of a qualifying event. The plans and carriers for the upcoming year is pretty much going to stay the same. Health insurance, United Healthcare. Now we are adding another plan through SBMA, which is the multi-plan. Dental, vision, life insurance, telemedicine, and accident, critical illness, and hospital all remains the same. So basically, the non-medical is going to be with MetLife. Vision is, it's also administered through MetLife, but the network is VSP. And then there's also Teladoc. So what are we doing with the medical plan? This is probably the biggest concern of most. We're still going to offer a choice of 3 plans. As I mentioned, the effective date of the change is going to be September 1st. The renewal for United is August, but we are going to, whatever plan that you're currently on will be moved over to whatever the current plan for that you select under the open enrollment will be for August, but the payroll deduction will be effective September 1st. So let me explain that again. And the open enrollment is going to be, it's going to be from August 4th, which I think is this Friday, all the way through August 14th. So whatever plan you select will be effective August 1st, but the payroll deduction will be September 1st. So I just want to make that clear. HMO plan, anyone that's on the HMO plan, it's going to be similar to the current plan. However, the network is going to change. It's going to change to the charter network. It was a Navigate network. Now it will be the charter network. It's going to remain with with United Healthcare. So if you're on the HMO, you're going to want to check to make sure your provider is still part of the charter network. Annual deductible is going to increase from $750 and $1,500. The office copay will remain the same. Urgent care copay is going to be reduced from $50 to $25, and the prescriptions will remain the same. Now, most people may think, well, it's going to go from $750 to $1,500. It's going to be a big deal. If you're using the benefits, yes, I can understand. However, several years ago, I was looking at changing the plan for my office, and my wife said to me, these are the benefits, these are the services that I'm concerned about. I don't care about your deductible. I want, and this is because we're looking at a family plan with kids. I want to make sure we have the office copay, the urgent care, the lab and x-ray, and prescriptions. She said, I don't want to go in the office, have to worry about deductibles and worry about getting the EOBs. So office copay we have here as the 15, I think, or 25. Urgent care, there's a copay. Prescriptions, there's a copay. Lab and x-ray, there's going to be the copay. So the deductible going from $750 to $1,500, in my opinion, isn't going to be a major issue, because that is where it's mainly going to be the inpatient or outpatient surgery or issues like that, MRI. So if you're receiving continuous treatment, I could understand, but we were looking at what's best because of the rate. For those of you that may be on the core PPO, that plan will no longer be offered. We looked at the cost, and in order to even have a cost that we thought was affordable, the deductible went up to $7,000, and it was pretty much a $7,000 deductible for all services, and then 100% coverage after that. We just didn't feel like it was a legitimate change. We're also going to, so the ones that are on the Choice Plus PPO, the annual deductible, again here, when we're talking deductibles, is going to go from $2,000 to $4,000 with the individual, and family is going to increase from $4,000 to $8,000. The coinsurance is going to be reduced from 30% after the deductible to 20% after deductible. Urgent care copay is going to be reduced from 50 to 25, and the prescriptions, the brand copay, is going to reduce from 65 to 40. So what do the plans look like? Again, the HMO is going to be through the charter network, not Navigate. So make sure you look at the network if your provider's in the network. Deductible is going to be $1,500 individual, $3,000 family. Coinsurance, 20%. Out-of-pocket maximum is going to be $6,100. I think it's $6,500 now. It's going to be $6,100 and $12,000 for the family. Office visit, the primary care is $15,000, specialist $50,000, preventative is covered 100%. And as you can see, the diagnostic, X-ray, MRI, outpatient surgery, inpatient hospital is 20% coinsurance after deductible. And then the emergency rooms, I think, remains the same, $300 copay per visit, then 20% after the deductible. Urgent care, $25. Pharmacy, tier 1 is the generic, $10 copay. Tier 2 is brand, $40 copay, and tier 3 is the specialty, and that's $125. Or it could be the non-formulary also. Choice Plus, this is the national network. So the core network, which we had prior, no longer available. That one is a limited, it's a more narrow PPO network. The Choice Plus network is a national network. You don't have to receive a referral from your primary care. You can visit any provider in the network. And again, it's a national network, not a local network. Whereas your HMO, you will have to receive a referral from your primary care in order to visit a specialist. The deductible on the PPO, 4,000 individual, 8,000 family. Out of network, 10,000 individual, 30,000 family. Co-insurance, 20% in network, 50% out of the network. Out of pocket maximum, 6,000 individual, 12,000 family for in network, and 20,000 individual, 60,000 out of network for the family. Office visit in network is a $15 primary care, $50 specialist. Out of network's 50%. After deductible, routine preventative care is covered 100% in network only. Outpatient diagnostic and lab x-ray, 20% after deductible in network, 50% after deductible out of network. The same for MRI, CT, and PET scans. Outpatient surgery, the same. Inpatient hospital stay, the same. Emergency room is a $300 per visit copay, then 20% after deductible for the in-network, while out-of-network, it's a $500 copay per visit, then 50% after the deductible. Urgent care, in-network's a $25 copay, while out-of-network's a 50% after deductible. And retail pharmacy, generic $10 copay. Tier 2 is the brand, $40, and tier 3 could be either the non-formulary or the specialty drugs. Finally, plan 3. Now, this is a brand new plan. It's a different type of plan, and this plan is a PPO program, so you can visit any provider in the network that you choose. So there's no deductible. There's no co-insurance. The out-of-pocket maximum with all the copays is $5,000 for an individual, $10,000 for the family. The office visit is a $15 primary care and $25 specialist. Now, this plan here, as you can see, has the limited number of visits per year. So under the office visit, the max visits per year is 12 visits. Routine preventative care is covered at 100%. Outpatient diagnostic lab x-ray is $50 copay, 4 visits per year. MRI, CT, and PET scans, $350 copay, maximum of 3 visits per year. Outpatient surgery, $350 copay with 2 visit max per year. Inpatient hospital stay, $350 copay, maximum of 10 days per year. And urgent care is a $35 copay, 2 visits per year. And again, that's going to be per person, per family. So if you have a family of 4, it's 4 visits. And I'm looking at the urgent care. It's 4 visits per person, per family. Prescription drugs. Tier 1, which is generic, is $5. Tier 2 is $40 brand. And tier 3 for the premier plan is $80, and that's for non-formulary. Specialty drugs is not covered. I do want to make a couple points here. You'll see at the bottom there's asterisks, which says after copay, benefits subject to reference-based pricing. What this means is that it's mainly going to be outpatient services, outpatient, inpatient, and emergency room services. So what this means is any hospital that accepts Medicare, the plan will pay up to 200% of Medicare. So as long as they take Medicare, they will accept your plan. we've had this plan for since the beginning of the year, and we have not had any questions or complaints. I know we have one group out of Georgia that has about 150 employees on the plan. And if there was an issue, that I guarantee you they would have brought it up to our attention. So again, when you're looking or when you're going through the online portal, your own portal to process your open enrollment, there will be plan summaries that I urge you to look at so you understand what's covered, what's not covered, the copays. So I urge you to make sure that you look at the plan summary as well. There's going to be links to the provider network, so you're able to make sure that your provider is in the network. One other thing when it comes to the network is I also urge you to reach out to your own provider so that you can ask them if they take the United or the Premier plan, because a lot of times just because it's in the directory doesn't mean that the provider will accept the insurance. Dental coverage. Again, now the rest of the presentation here, the coverage is going to be the same as this year. Some of the plans here, we actually have a 4-year rate guarantee. So the plan ain't going to be changing for 4 years. But dental, I think our guarantee is through 2024. So those of you that are on the two plans, one of the two plans, the plan's going to remain the same. The cost is going to remain the same. So deductible, there's two plans. Plan one, actually both plans are pretty much going to be the same. The only difference between plan one and plan two is going to be the maximum benefit for the year. Plan one, the max is 1,000, while plan two, the max is 2,000. Both plans for preventative services are covered at 100%. Basic services are covered at 80%. It covers you can see under the preventative services what benefits are covered, what services are covered. Same with the basic. Major services are covered at 50% for both plans. And orthodontia, both plans are covered at 50%, even though it says 500%. So that's a typo. And again, the difference between the two different plans, option one covers up to, the benefit is a max of 1,000, including orthodontia lifetime of 1,000. And option two, up to 2,000 for the dental services, and then 2,000 for orthodontia. So again, if you're on the dental plan, that will not change. Vision, same thing, you're on vision, will not change plan or rate. The option one is a 1224. What that means is the eye exam is a $10 copay once every 12 months, while the lens, which includes glasses and lens, is covered at a $25 copay every 24 months. And contact lens is once every 24 months, but that would be instead of prescription glasses. Option two, the same as option one, except instead of 24 months for the lens frames, it's every 12 months. So copays are the same. The only difference is plan two is a 12-month eye exam and 12-month glasses, whereas option one is 12 months for the exam and 24 months for the glasses. In addition to your optometrist or ophthalmologist, it includes the VSP directory for retail chain providers of Costco's, VisionWorks, and Sam's Club. So again, you're on the vision plan. It is the plan will remain the same for 2024. Supplemental life insurance. If you're on the current plan, again, it will remain the same. The employee is 5 times your annual salary, up to a maximum of $150,000. For your spouse, 50% of your amount, maximum of 50,000. Dependent children, maximum of 10,000, and there's increments of $2,000. Evidence of insurability will not be required when first eligible. So if you did not take life insurance out in this past year, you will have to answer 3 questions. So again, if you're a new hire or new to the program, then you will not answer any questions. However, if you're looking to add life insurance, second year now, you will have to answer health questions. Telemedicine, again, this won't change either. If you're on the plan, then there will not be a change in cost or the plan. If you happen to have one of the healthcare plans, you do not need to enroll in the telemedicine because it's also covered under the healthcare provider. So the next time you're sick, you can call in to the teledoc. They will reach back out to you within 14 minutes on average. There's no cost to it. You provide them with your symptoms, they'll give you a diagnosis, and they'll even call in a prescription, which a lot of carriers don't do that. So you can connect by phone, video, or app. I know this works. I came back from a IFA conference and I ended up being sick out there, but when I came back, I still wasn't feeling well. I called the urgent care and they ended up sending in a prescription for me. And in fact, the doctor actually called me afterwards to make sure I was okay. So unlimited use for all family members up to a total of 5. And you can call in for cold and flu like I did, allergies, bronchitis, sinus, ear infection, and whatever you feel you need to speak to a doctor, especially when you're not in the office or you're not able to visit make it to a doctor, then teledoc is a good way to go. Supplemental medical plans. So if you're not interested in any of the medical plans, but you do want to have a low-cost medical, Mech Plus plan may be a plan for you. There's no deductible. Out-of-pocket maximum is $6,700 individual, $13,400 for a family. Covered services, routine physical is covered at 100%. Primary care and specialists is a 15 copay. Urgent care, lab, and x-rays is a 50 copay. Telehealth is included with it. And prescription drugs, generic drugs only, is a 15 copay. Now, as you can see, it doesn't show inpatient, outpatient. Those services are not covered under this plan, as well as emergency services. So pretty much routine visits are going to be covered, including the preventative care, and just so you, once again, inpatient, outpatient, and emergency services are not covered under this plan. Hospital indemnity. So if you're thinking of looking at the MEC plan here, although it does not cover the inpatient, outpatient, or emergency service, you could add the hospital indemnity plan. Benefits cover both injuries and sickness. Benefits are paid directly to you. Similar to an Aflac plan, the plan does not pay a benefit to the hospital or your provider. The benefits are paid for inpatient and outpatient medical treatment received in the hospital room or emergency room and the physician's office. It also includes routine childbirth and complications of pregnancy. Additional benefits include surgery, anesthesia, diagnostic exams, rehab facility, and lodging. So it does include additional benefits. And the cost on, if you wanted to add the hospital indemnity to the MEC plan, then the average cost is probably going to be $165 a month. Accident is another benefit that you could choose. It covers accidental injuries regardless of any other insurance. Again, it's paid to you. similar to an Aflac plan. Benefits for both inpatient and outpatient treatment. Covers more than 50 services. Includes hospital admission, hospital confinement, ambulance, emergency room treatment, physical therapy. Now, it covers a benefit that will pay you, again, for inpatient or outpatient services for an accident. In addition, it'll pay lump sum for fractures and dislocations. So if you fracture your hip, it'll pay you benefits for the hospital stay if that's what you need. And it'll also pay, let's say, up to $10,000 for, let's say, the hip fracture. Also pay for dislocation. So if, let's say, you dislocated your elbow, they'll pay for a lump sum in addition to the services that were required. Critical illness, it pays a lump sum benefit upon critical illness diagnosis. You have a choice of $10,000 or $20,000. Spouse dependent children offer at 50% of the employee amount. The critical illness benefits are paid for cancer, heart attack, kidney failure, major organ transplant, Alzheimer's disease, Parkinson's disease, multiple sclerosis. It covers up to 20 different benefits. And finally, disability. We're playing MetLife, short-term disability, 60% of your pre-disability earnings up to $1,500. So the plan will pay 60% of your earnings not to exceed $1,500. And again, this is on a weekly basis. Benefits will begin on the 15th day or the day after, or you can say 15 for 14 days for accident, and there's a 14-day waiting period for sickness. So 14-day waiting period for both accident and sickness will begin on the 15th day. Benefit duration is up to 26 weeks. Definition of a disability is due to sickness or accident injury. The employee is complying with the appropriated care and treatment and is unable to earn more than 80% of pre-disability earnings at their own occupation. Now turning to how to enroll. Now that we're in the open enrollment period, you'll receive a link, and it'll be before Thursday. You will receive a link from your employer. Actually, you're going to receive it from us to access your web enrollment. As you did before, you complete your registration if you're new. Otherwise, you have your password to log into your account. You'll need to verify your personal information, add any dependent information, begin the enrollment process just like you did when you initially enrolled. Choose the benefits that you want to enroll in or re-enroll. Choose your coverage level. You can make changes there. Continue until your enrollment is complete, and then you e-sign your enrollment form. Make note here, though, if you do not receive the end of the enrollment that says you're finished, you did not complete, you missed something in your enrollment, you will need to go back into it. Just to make note here also that if you don't finish, we do not know that what changes you made, and they will not be integrated with the carrier. So again, you have to make sure that you go through the full process and that you sign your application at the end of your enrollment. Deadline is August 15th. And the reason for that is on the 15th, all the changes, all the enrollments will be automatically submitted to the carrier so that we get in the any type of changes. So, questions. If you have any questions, there's a chat box there. If you could type in your questions, and then we will answer them. Doesn't look like we have any questions. Jim, you have any questions or anything you want to add to it? If you can just put it in the chat box here. I don't see any questions here. Again, open enrollment's going to start on the 4th. It'll be through the 14th. Jim just mentioned that the chat is not it looks like it was disabled, that any questions should be put under the Q&A. Again, open enrollment from the 4th through the 14th. We will have a employee guide that will be distributed to everybody. We will have it over to Jim Fender, and he will get it out to everybody. We should have that. Today's the 1st. We should have that out to everybody tomorrow or on Thursday. Good question, George. I should have mentioned that the rates will be on the in the portal. There are different rates for the different plans, and they will be outlined in the portal, mainly for the health insurance. The dental and vision rates will be outlined in the guide. Matter of fact, now that I think about it, the healthcare rates will be in the employee enrollment guide that will I'll send over to Jim, and he'll get it out to everybody. So the guide will include the rates for the medical and the other benefits, as well as the ease portal. So good question, George. Any other questions? Jim, you got anything to add? Doesn't look like it. Okay. Hope everyone understands the plan changes. Any questions, you could reach out to me. I think most of you that are on the participating on this call have reached out to me one way or the other in the last several weeks, so you have a way of reaching out to me. Hope everyone has a good afternoon, and then we look forward to you handling your enrollment. Thank you.